Hi, I'm Amber Littler. I'm a physician assistant at the Hotze Health and Wellness Center. We got a great question this week from Lisa. Lisa's asking about gluten-free diets because she says she's been hearing a lot in the media about this lately and is kind of wondering what it is and if it's for her. Gluten-free diets are not really typically what we think of as a diet. In other words, you wouldn't do it for weight loss or some reason like that. They're really designed for people who have a gluten intolerance. So I guess the real question is, how do you know if you have a gluten intolerance and need to be on this diet? You know, when I'm talking to guests here in the office, I usually think of the possibility of gluten problems. If anybody has, Hashimoto's thyroiditis or other autoimmune diseases like lupus or rheumatoid arthritis, people that have a lot of joint pain or stomach trouble, even people that have anemia that they haven't been able to find another reason for it. For these people, I usually recommend that they do a gluten-free trial and see how they feel off of it. Maybe add it back in later and see, do those symptoms come back and they feel worse? And it kind of gives them an idea of maybe that's something they should be avoiding. For a lot of more information, we actually did a webinar last month that's viewable on our website. If you go to www.hotzehwc.com, you go under featured posts. On February the 13th, I did a webinar. It's only about 45 minutes long, and we answer all of the main questions about gluten, what it is, the avoidance of the wheat and rye and barley, and how you go about doing that. And what sort of symptoms would be involved, for somebody who might have this problem. Lisa, I think you'd get some great information out of that webinar. Certainly if you have any questions, then feel free to talk to your provider. You can call up to the phone nursing department or come in and see us. Keep in mind these things I mentioned, like joint pain and stomach trouble, can be due to a lot of other things. So certainly worth speaking to your provider about if you have any doubts.